Stabbing pains. Now this is not so much the tingling, but you just suddenly get a stabbing pain, a shooting pain. Maybe the pains just come and go anywhere on the body, and you never know when they're going to appear. So the main area are the breasts, the chest area, the legs and the stomach. So I'll look at these on an individual basis because they can be really quite different. So we know generally that falling estrogen can affect nerve function. We know too that nutritional needs go sky high. You need plenty of B vitamins and magnesium to support the nerves themselves. So if your nutrition is a bit low, it could be just a really simple case of you're needing a bit more magnesium and a vitamin B complex. But what can happen too is that falling estrogen increases our pain perception. So we feel pain more than what we did before. So you may have had a few, aches and pains generally before hormones shifted, and suddenly you're getting a lot of joint aches and pains. So that's just because your pain perception has changed, not that anything has got particularly worse. Other thing that can happen too is that our connective tissue can decrease, or it's not repaired. Now, connective tissue it's almost like a kind of glue that holds our skeleton together. But the connective tissue is flexible and it helps us move all our different joints. So if that connective tissue decreases, that will affect your joint movement and joint range. And that in itself can end up causing stabbing pains to the joints. And this is where basically things like the knees and the hips come in. So just be aware of that one. For the chest pain, there's something called costochondritis. So this is the tissue that's connecting the ribs together. So if that gets inflamed, then anything you do where you're reaching up, turning round, moving back or forward, that's going to cause a stabbing pain. So if the stabbing pain is connected to any type of movement, especially in this area, really important to get this checked out by your doctor, just to make sure that it's not anything to do with your heart rather than the ribs. The other area where you can get these stabbing pains are the breasts. Again, it can just be due to estrogen, lower estrogen affecting the estrogen receptor sites. It can be more cyclical. So if you're in the perimenopause, you may find that you just get the stabbing pains before a period is due. Some people find that a kelp supplement can help. We're not quite sure why. It's just one of these things that sometimes it can reduce the discomfort. It can be dehydration, something as simple as that. So remember to keep your water intake up. But any breast changes, any breast pain, this needs to be checked by your doctor as well. So don't put up with this one for months and months. Just get this one checked out. If it's stomach area, so if it's here, if you're getting stabbing pains, it can be a number of things. It can be a prolapse. It could be due to the fact that the womb is changing. For some women, womb tissue can shrink in the perimenopause and menopause. For other women, it can actually get thicker. So again, if the stabbing pains are coming with your cycle, whenever that comes, just get this checked out by your doctor. If you're getting stabbing pains, especially when you sit down or you bend down, it could indicate a prolapse. Again, get this checked out by your doctor. This one's really important because there's all sorts of other issues. It can be things like polycystic ovaries. It can also be fibroids as well. So especially if you're getting heavy bleeding at lots of different times and the stabbing pain, please get this checked by your doctor. I hope you found this one helpful. Remember, I always love to hear your stories and your comments, so please keep those coming in. I'll see you later and have a lovely week.